Mozart Piano Concerto Number 20 in D minor. This is Democracy Now!, democracynow.org, the War and Peace Report. We're broadcasting on close to 800 stations, on Pacifica and NPR stations, on low-power FM college and community radio stations, on public access TV and PBS TV stations, and both TV satellite networks, on Dish Network, channel 9415 Free Speech TV, 9410 Link TV, and on DirecTV, channel 375. And we're video and audio podcasting at democracynow.org. Our headlines are also available in Spanish for any radio station to take, as over 200 are. You can go to our website for transcripts of every broadcast from top to bottom, for headlines in Spanish and in English. And the best way to get word out about Democracy Now! On television, on radio, on the internet, is to tell your friends, is to push out the information, to send it, to email it, to follow us on Twitter at democracynow.org. We depend on you. This is public media. I'm Amy Goodman with Juan Gonzalez. Juan?
Well, thousands of patients and healthcare reform activists have been staging protests in recent weeks outside the offices of the nation's major health insurance companies. In New York, 17 people were arrested Monday outside the office of Aetna. In Chicago, 6 people were arrested last week outside the downtown headquarters of Blue Cross and Blue Shield of Illinois. Our next guest took part in a protest last week outside the corporate headquarters of CIGNA in Philadelphia, where she shared her story about how CIGNA had denied medical care for her family. Stacie Ritter has twin daughters, Madeline and Hannah, who were diagnosed with cancer at the age of 4. Last year, CIGNA refused to cover growth hormone therapy for Madeline and Hannah, and even though it was prescribed by their endocrinologist, had been previously covered by the family's former insurer.
For months, Stacie Ritter fought with CIGNA, but the company refused to reverse its decision. The incident marked just the latest chapter in the family's ongoing troubles with the health insurance industry. A few years ago, the Ritters filed for bankruptcy due to their high medical expenses, even though they had health insurance at the time. Well, to talk more about what happened, Stacie Ritter joins us now from the studio in Philadelphia. We did invite CIGNA to join us as well, but the company declined our request. Stacie Ritter joins us now. Welcome to Democracy Now!
Hi, thank you, Amy.
Hi,
Thanks for having
Stacie.
me.
Tell us your story.
Well, it's a rather long one, so I'll try to make it as brief as I can. Our issues with insurance companies have been going on now for quite a while. It didn't start with CIGNA, though, until April Fool's Day of 2008, is when my husband's employer switched insurers to CIGNA, which, again, as far as healthcare is concerned, you don't have a choice. When your employer switches insurers, you get what they give you. And unfortunately, we were given CIGNA. My girls are cancer survivors. They had pituitary and hypothalamus gland damage as a result of chemo and total body radiation to treat their cancer as part of the stem cell transplant that they had when they were 4 years old. And a lot of times when a child has that issue, they end up on growth hormone. Many years later, once the oncologist notices a plateau in their growth, which mine did back in 2005. So she referred us to an endocrinologist at Children's Hospital in Philadelphia, and he monitored them, and they didn't start growth hormone until 2007. So that was 2 years of monitoring to make sure, that it wasn't just a little lax in their growth and that it was really a damaged pituitary and hypothalamus. And once they started the growth hormone under our previous insurer, which was Aetna, they did very, very well. And so our doctor said, well, then that's their positive response to the medication is proof that it was damaged, then, the hypothalamus and the pituitary gland. So that was great. So we'll continue to do this until their bones start to fuse and they no longer need growth hormone. But unfortunately, CIGNA does not feel the same way that our previous insurer and our world-renowned expert doctor felt. So they claim to have had 2 endocrinologists look at our case, and both of their endocrinologists deem that my girls just suffer from idiopathic short stature, which means short stature of unknown origin. But quite to the contrary, we know the origin. We have lots of documentation and proof of the origin.
And that was, you say that was the radiation that they were exposed to deal with their rare cancer.
Yes, and the chemotherapies too are very toxic, and also depends on the child's age at the time, and even the sex has a lot to do with it. So the younger the child, especially under 5, which mine were, they were 4 at the time, and the sex, the females tend to suffer more damage than males for some reason from the total body radiation. Not all children with cancer have these kind of late-term effects. It's only children who have had radiation to the brain area, which mine did.
Well, and once CIGNA denied you, how long did the appeals process go on for you to try to get them to reverse the decision? And what was happening in between the time that they denied you? Did they immediately were your daughters then not able to get the drug?
Well, we were very fortunate to be treated at Children's Hospital. The doctors there know how the insurance companies work. So when I told them ahead of time that my husband's employer was switching insurers, they immediately enrolled us in a program sponsored by the drug company that makes the growth hormone that we're using. And that program is like a bridge program where they will supply and even have representatives represent me in the appeals process. So, no, we didn't have to go without it, thankfully, because my doctors were proactive and knew that the insurance company was going to go through this and deny it and give us the runaround. Once, it was about three months of dealing with CIGNA. My doctors called them and did a peer-to-peer because they were not approving it. You know, the written information and the medical documents were not enough for CIGNA. So they had a peer-to-peer review scheduled, and CIGNA even went as far as approving the medication for my one daughter on that peer-to-peer review with our endocrinologist, and claiming that it had no knowledge of my other daughter existing. They had the knowledge that she existed when they sent me the denials for her.
They're identical twins.
Yes. Mm-hmm.
Well, we invited CIGNA to join us on the program, but the company declined our request. The spokesperson, Chris Curran, issued the following statement, quote, "There was no laboratory evidence of growth hormone deficiency. Over a year ago, we had 2 endocrinologists review this case, and based on the laboratory studies, they agreed there's no need for the drug. This is the first time we're hearing about the family's concerns and disagreement with the decision. We would welcome review of new information as technology and medical evidence is in constant evolution." Your response, Stacie Ritter.
That's a joke. I just received, every year we have to re-enroll in this program. And my doctor had to resubmit a request for coverage to CIGNA again this year. And we just received this year's denial letters from CIGNA on the situation. And then had to re-enroll again with the manufacturer. And that's carrying us through then. So they're very aware of the situation. They have been. Unfortunately, our primary endocrinologist, who was handling our case, had passed away himself of pancreatic cancer last year. And in the scurry to try to cover all of his patients, all of the doctors there in the endocrinology department have had to divide them up. So I've had at least 4 different endocrinologists from CHOP working on my case alone, from writing letters to the peer-to-peer to the correspondence from the manufacturer to me calling them. They're very aware of the situation.
Well, I'd like to turn to, for a moment, to a former CIGNA executive, Wendell Potter, who we've interviewed on Democracy Now! In the past. Up until this year, Potter was head of communications for CIGNA, and since leaving the company, he's become a prominent critic of the health insurance industry. Wendell Potter accused CIGNA of dumping the sick to maximize its profit.
They have begun shifting their business model away from managed care, which, frankly, I used to think was a great model, a great concept for the delivery of health care. But they're moving away from that to what they refer to as consumer-driven or consumer-directed care. And it really is just a euphemism for shifting the financial burden from insurers and employers onto the shoulders of working men and women.